with mental illness have higher rates of morbidity and mortality. The rates are high enough to create a public health crisis.
The leading cause of death in persons with mental illness is cardiovascular disease.
Many of those who suffer from mental illness take medications such as atypical antipsychotics, which can cause weight gain and increase lipid levels. This increases the risk for cardiovascular diseases.
Studies have found that people with schizophrenia eat more sugar and fat and less fruits and vegetables. People with bipolar disorder consume less fruits and vegetables. And those who suffer from major depression eat more carbs and simple sugars.
Lifestyle interventions adapted to persons with mental illness show promise in reducing weight and decreasing risk factors for metabolic syndrome.
We did our psych rotation at CUHSON Behavioral Health Facility. It is a center that offers a variety of programs that provide a supportive and encouraging milieu environment to promote personal improvement and rehabilitation. Services that are provided here at CUHSON include healing forces for trauma, recovery, inpatient services, an adolescent partial hospitalization program, and electroconvulsive therapy services. The patients that we worked with and our target population are forensic inpatients. Basically, this means that they have committed some crime and are awaiting to stand trial or to be deemed fit to proceed. The clients have mental illness and are taking psychiatric medications that place them at a higher risk for comorbidities and mortality. Based on these facts, we observed the different dietary habits or options they had access to at CUHSON.
At CUHSON, we observed the clients did have a wide range of food options available through the cafeteria at mealtimes. They have a salad bar, soups, several entrees, and side options. They also have sandwiches and wraps, desserts, different drink choices. Unless they are on dietary restrictions, clients are given free choice at mealtimes with no limitations and with the option for seconds. Also, because the food is prepared for them, the clients may not be entirely aware of what is in the foods that may or may not be good for their own dietary needs. We feel that there is a lack of education of what a healthy and balanced diet is. We also observed that there was a lack of exercise participation, which is an integral part to their health. Many of the clients do not actively participate in exercise, and because they are given a choice to do so.
Good. Let that one slide. Turn and slam. Back over the top. You got it. Smile or burn the fat. Yes, we are. One more time. Ready? Over the top. Great. And wrap it. Get low. Get low.
To address the needs of our target population, the group decided to focus on lifestyle intervention teaching, specifically diet and nutrition. To do this, we focused our education on food groups, recommended daily serving sizes, and caloric intake. We also demonstrated how to read food labels appropriately and highlighted simple but important information such as determining serving size. Because the clients were acutely ill, the information we presented was kept fairly basic. As far as recommended servings, we used common objects such as a deck of cards, dice, and a baseball as an aid to help clients visualize portion sizes. Client interaction was achieved by doing a brief eat this, not that activity. The clients were presented with 2 food choices and were asked to select which one they thought was the healthier choice. For example, they were shown a picture of a McDonald's Egg McMuffin and a raisin bagel with cream cheese, and was asked to decide which one they thought was the healthier choice. Surprisingly, the Egg McMuffin was the better choice. This was backed up with the nutrition facts for each. We also did the smoothie demonstration. In the smoothie, we incorporated 3 food groups: veggies, fruits, and dairy. This showed how to take in multiple food groups in one sitting, and that is simple yet tasty. Some clients go on to community-based residential settings and prepare their own meals. So lastly, we thought it would be helpful to hand out recipes to take home that are healthy and easy to make.
To assess the effectiveness of the project, we used a simple evaluation method of giving a pre and post test. To measure understanding, the post-test consisted of the same 5 questions as the pre-test. It was made up of multiple choice, true and false, and matching type of questions. This simple evaluation method provided evidence of the effectiveness of our teaching. During the pre-test, the group of clients got 2 out of 5 questions right. They correctly identified the food groups but were unaware of the correct recommended daily servings. They also incorrectly selected the raisin bagel as being a better food choice than an egg McMuffin. After the presentation, they retook the test and scored 100%. The results of the pre and post test show that there is a need for diet teaching and that it is an effective method for educating clients. If these clients can take what they learned from today and apply it when making their food choices, it can help lower their risk for illness such as diabetes and cardiovascular disease.